Welcome to Labrador Retriever Care and Training Tips from www.trainpetdog.com. How to prevent hip dysplasia in a Labrador Retriever. Known as the #1 dog in America, the Labrador Retriever has held that spot in America's heart for nearly 2 decades, making it the most loved dog in America. Labs are known for being a very active breed that is affectionate, loyal, and good-natured. They are generally very easy to train, and they are eager to please their owners. They are extremely loyal, and while they maintain a youthful playfulness throughout their life, the Labrador Retriever makes a gentle family companion. However, the breed does suffer from many health problems, much of them stemming from overbreeding or improper breeding practices. Labs can suffer a number of health problems, including bloat, progressive retinal atrophy, epilepsy, retinal dysplasia, osteochondritis dissecans, and several other eye and bone problems. Hip dysplasia is one of the serious health problems that affect this breed. But what is hip dysplasia? If we look at it simply, hip dysplasia is a disease that affects the hips, or more specifically, the hip joint. It is a genetic disease that occurs when the joints do not fit together properly due to abnormal development and begin to separate and rub, causing a subluxation. It is very common in labs, and while puppies are usually born healthy, the joints develop abnormally, resulting in the disease. It is important to note that hip dysplasia is a disease that can affect a dog during any stage of their life and is not reserved to older dogs. Prevention number 1. Find a good breeder. Since hip dysplasia is an inherent disease, it is important to find a really good breeder. Do your research and make sure the breeder is a reputable one with a long history in the Labrador Retriever world. Make sure that the breeder only uses healthy, screened dogs, and he or she runs a good program that ensures the health of the puppies. Never purchase a lab puppy from a puppy mill or backyard breeder. And be careful with purchasing from a pet store, since these puppies often have more potential for hip dysplasia. Prevention number 2. Research your puppy's line. While it is important to look at the breeder, also look at the lines your puppy is coming from. Make sure you check all the grandparents and parents of the puppy, especially if they were not a part of that breeder's kennel, to ensure that no hip dysplasia was found. In addition, go back 3 or 4 generations and ask the breeder if any of those puppies had puppies with hip dysplasia. He may not be able to answer for every puppy, but he will know of some dogs if there were any. Also, a good breeder will have hip certification on all of his dogs and will be able to provide it to you. Prevention number 3. Good nutrition. While hip dysplasia is inherent, there are some ways that you can alleviate some of the risks of hip dysplasia. Good nutrition is one of those, so it is important to feed your dog a well-rounded diet that meets all his nutritional needs. In addition, add supplements for bone health, especially with senior dogs, but make sure you avoid it when your puppy is going through growth spurts. Try to find a dog food with few fillers. Prevention number 4. Staying fit. Like good nutrition, keeping your lab fit will ensure that he has fewer problems with his hips. Labrador Retrievers are prone to obesity, and this unnecessary weight can put added strain on your dog's hips. This can increase the risk of hip dysplasia, and excess weight can lead to other health problems. Make sure your lab is given ample exercise each day, 60 minutes or more, and make sure to limit the number of calories and junk food your lab eats. Prevention number 5. Limiting activities during key developmental periods. Labs are very energetic dogs, and as puppies, more so. This can make it hard to limit activities. However, it is important to ensure that there is less stress on their hips. It is recommended to avoid playing on uneven terrain, since a stumble could injure the hip joints and lead to a deterioration of the joint. In addition, jogging before they reach the age of 2 can lead to problems with hip dysplasia. If they do jog with you, limit it to soft surfaces. Remember that growth spurts are key periods when damage to the joints can occur. It is important to note that the link between hip dysplasia and obesity, poor nutrition, and lack of exercise is only a theory. And while all these things can have an effect on a lab's hips and the progression of hip dysplasia, the only way to reduce the risk is by purchasing from a reputable breeder who only uses healthy dogs in his or her breeding program. Thank you for watching How to Prevent Hip Dysplasia in a Labrador Retriever. To learn more about caring for your lab, visit the link below.